Hey everybody, this is Rishi Agarwal, and in this video I'm going to be talking about anatomy. Specifically, we're going to be talking about the branches of the thoracic aorta. And I'm going to start with this drawing here, and I'm going to show you what normal anatomy looks like. Then I'm going to show you a few variants of normal anatomy, and then I'm going to show you some abnormal cases. And we'll look at CT and angiography. And we're going to start first with this drawing here. This is the ascending aorta, this is the aortic arch, and this is the descending aorta. Now, the only branches that come off of the ascending aorta are the right coronary artery and the left main coronary artery. The right coronary comes off of the right sinus of Valsalva, and the left comes off of the left sinus of Valsalva. There's also a posterior sinus, but there's no coronary artery that comes off of the posterior sinus. Okay, then we have the ascending aorta. The ascending aorta is covered by pericardium. The continuation of the ascending aorta is the aortic arch. The aortic arch begins posterior to the right second costosternal joint. It arches over the left pulmonary artery and ends posterior to the left second costosternal joint at about the level of the sternal angle. Now, there's multiple different ways that the arch branches can come off, but for the most part, most of the time, it's this configuration. This is the most common branching pattern, where you have three arteries coming off of the aortic arch. The right brachiocephalic is the first, the second is the left common carotid artery, and the third is the left subclavian artery. The right brachiocephalic is usually the largest because it gives rise to two arteries, the right subclavian and the right common carotid. Then you have the descending aorta, which descends in the posterior mediastinum just to the left and anterior to the vertebral bodies. And it terminates at the level of T12, where there's the aortic hiatus. That's where the thoracic aorta stops and the abdominal aorta begins. You also have the thoracic duct and the azygos vein that go through this hiatus. Now, there's multiple vessels that come off of the descending aorta. The largest of these are the posterior intercostal arteries. These are paired arteries, but I've only drawn them in on the left. And most of the time, there's 9 arteries that go from the 3rd rib to the 11th rib. And then the artery that supplies the 12th rib isn't called a posterior intercostal. Instead, we call that the subcostal artery. These posterior intercostals tend to come off the posterolateral aspect of the aorta, and they go around the chest wall along the undersurface of their respective rib, and they anastomose with the anterior intercostal arteries. The anterior intercostal arteries are branches of the internal mammary artery, which is also called the internal thoracic artery. Now notice you don't have intercostal arteries from the first and second ribs that come directly off of the aorta. Instead, intercostals for the first and second ribs come off of the costocervical trunk, which is a branch of the subclavian arteries. And then you have the bronchial arteries. The right and left bronchial arteries usually come off of the anterior aspect of the aorta at around the level of T5 to T6. Now, there's a lot of anatomic variation in the bronchial arteries, but usually the left bronchial artery comes off of the aorta itself, and frequently the right bronchial artery comes off of the 3rd posterior intercostal artery, which goes up and to the right. You can also have multiple bronchial arteries, so frequently you'll have 2 left bronchial arteries and 1 or 2 right bronchial arteries. Now, as I said, there's a lot of variation here, and sometimes the bronchial arteries can come off of the subclavian, sometimes they can come off of the internal mammary, occasionally they can even come off of the ascending aorta, although that's pretty rare. And then next we have very small arteries that come off of the anterior aspect of the descending aorta, and these are esophageal arteries, pericardial arteries, and then mediastinal arteries that go to serve other organs in the mediastinum like lymph nodes. These arteries are usually pretty hard to see on CT and even on angiography. And then last you have the superior phrenic arteries that come off just above the diaphragm to serve the superior aspect of the diaphragm. These are also pretty hard to see, and they anastomose with other smaller branches of the internal mammary artery. I want to show you some variant anatomy that you might see. One common normal variation is something called the bovine arch, and that's where you have a common trunk that gives rise to the right brachiocephalic artery and the left common carotid artery. Now, in my report, when I see this, I usually just say that there's a common trunk that gives rise to the right brachiocephalic and left common carotid arteries, because not everybody uses that term bovine arch. Here's what it looks like on CT. This is the common trunk, this is the right brachiocephalic artery, and this is the left common carotid artery. And then if I scroll back, this is the left subclavian artery over here. Another common variation is something called a four-vessel arch, where the left vertebral artery arises directly off of the aorta instead of the respective subclavian artery. This is what it looks like on a coronal CT scan. So right here is the right brachiocephalic artery, that's the left common carotid, and as I scroll back, that right there is the left vertebral artery going up. Here's what it looks like on the axial images. So here's our normal right brachiocephalic, left common carotid, and then as we keep going up, you could see there's two more vessels here. So that's the left vertebral, and that's the left subclavian artery. Here's another normal variant called an aberrant right subclavian artery. This is where you have the right subclavian artery coming off the distal part of the arch. It goes behind the esophagus and then ascends to its normal position in the supraclavicular region and then onto the arm. In this situation, you don't have a brachiocephalic artery on the right. Instead, the right common carotid artery arises directly from the aortic arch. Here's what the aberrant right subclavian artery looks like on CT. So you could see we have a normal arch on the left side, but the right subclavian artery comes off of the distal aspect of the arch. This is the esophagus right here. It goes right behind the esophagus. And if we follow it up, you can see it goes up to the right supraclavicular region and then onto the arm. This is a patient who's had a gated CTA, and let's just go through and see what we can identify. So first off, this is the right coronary artery, and it's coming off of the right sinus of Valsalva. This is the posterior sinus right here, and notice there's no artery that comes off of that. This is the left sinus, and that right there is the left main coronary artery. And then as we go up, we don't see any other arteries coming off of the ascending aorta. And then we have our normal arch branches right here, right brachiocephalic, left common carotid, and left subclavian. Then as we go down, you see a bunch of small vessels that are coming off of the posterolateral aspect of the aorta. Here's one right there, there's another one. So these are the posterior intercostal arteries. Remember that these go from the 3rd rib to the 11th rib, and then the artery supplying the 12th rib is called the subcostal artery. And the intercostal arteries for the 1st and 2nd ribs come off of a branch of the subclavian artery. The first posterior intercostal should be the 3rd. So this is the 3rd posterior intercostal right there, and we can follow it up. It goes off to the right, and it goes to the 3rd intercostal space. As you go further out, it gets harder and harder to see. But that's it right there. And if you look, there's another branch that comes off of it right there. This artery right here is the right bronchial artery. And if you follow that, that goes behind the right main bronchus, and it continues on posterior to the right bronchus intermedius and off into the hilum. Now the left bronchial artery should come off directly from the aorta. And there it is right there. It's hard to see because it's small, but this right here is the left bronchial artery coming off of the anterior aspect of the aorta. Now I mentioned there's also small branches that go to the esophagus, go to the pericardium, as well as lymph nodes, but these are very hard to see. This is probably one right here, right there, but it's very faint, and these are very small branches. Let's next take a look at a normal conventional angio. Here's a patient who had a conventional angio. The catheter tip is here in the ascending aorta. The aorta looks like it's splayed out here, but that's just because of the obliquity. And these are the normal arch vessels, so right brachiocephalic, left common carotid, and left subclavian. Here's another obliquity of the same thing, so right brachiocephalic, left subclavian, and left common carotid artery. Here's an image of the catheter in the descending aorta, and you can see there's some reflux of contrast into the arch vessels, but mostly what's lighting up here are these posterior intercostal arteries. And there's a vessel right here that takes a turn downward and goes off to the right. This is the right bronchial artery in this patient, which arises from this third posterior intercostal artery. You can also see in this image that the left internal mammary artery is filling with contrast. So this gives rise to the anterior intercostals, which will anastomose with the posterior intercostals. As I mentioned before, it's common to have multiple bronchial arteries, and this patient had a common trunk that gave rise to another right bronchial artery and the left bronchial artery here. One important clinical correlation of this variant anatomy is that the bronchial arteries can give rise to feeders that go to the anterior spinal artery. And interventional radiologists look for these feeders because if you're doing a bronchial artery embolization, one of the known, it's rare, but one of the known documented complications of bronchial artery embolization is spinal cord ischemia. Now let's take a look at some abnormal anatomy. Here's a patient who has had a history of multiple pulmonary emboli. You can see here that there's a large vessel that comes off of the distal aspect of the arch. And if we follow it, it goes off and goes to the right hilum. And this is a hypertrophied right bronchial artery. And you can see that there's even a pseudoaneurysm of one of the branches here in the right hilar region. There's many reasons why the bronchial arteries can hypertrophy. Chronic thromboembolic pulmonary hypertension is one. You can also see it in cases of bronchiectasis, like patients with cystic fibrosis commonly have bronchial artery hypertrophy. Let's see if we can find the left bronchial artery here. You can. It's here. This is the left bronchial artery. It's much smaller than the right bronchial artery, but it's still hypertrophied. Here's a patient who has an aortic coarctation. It's right here. This patient's coarctation occurs just after the takeoff of the left subclavian artery. And what you'll notice is that there's large posterior intercostal arteries here. This happens because the body is trying to get around this narrowing here. So it wants to send blood from this side of the aorta to this side. And because this is narrowed right here, it has to find other channels to do that. So remember that I mentioned that the posterior intercostal arteries anastomose with the anterior intercostal arteries, which are branches of the internal mammary. So in this case, these posterior intercostal arteries are not getting blood from the descending aorta. Instead, the blood is going from the posterior intercostals to the descending aorta, providing a collateral pathway in this patient. This is a chest x-ray of a different patient with coarctation, and you can see here's rib notching at multiple levels, and that's because we have hypertrophied posterior intercostal arteries. And this is the third rib right here, and notice we don't have notching in the first one or two ribs, and that's because the intercostal arteries from the first and second rib comes from the costocervical trunk, not from the descending aorta. Okay, so that's all I wanted to show you today. This has been an overview of the branches of the thoracic aorta. I'll leave a link to the drawing that I did of the aorta and its branches, and if you have any questions, please leave them in the comments below. Thanks.